I don't think it is fair to say that the current millennials are softer or don't know how to. I think
Fela in Malawi. Welcome back, everyone. This is a very special episode because I've got, once again, a special guest, Dr. Chiwoza Bandawe. Thank you for coming on, sir.
Thank you. Great to be here.
Yeah, this is it's a very humbling experience for you to give us your time. I know that your time is very valuable. I'm going to do just the introduction of your name, and from there, if you could just tell us who you are and what field you're in, what you do, because I know I won't do it as well as you are, and correct me if I'm wrong, but my understanding is that you are a psychologist and you're one of the preeminent psychologists in Malawi.
Yes, so I am a clinical psychologist. I'm the first Malawian clinical psychologist. That's exactly what I am, based at the University of Malawi College of Medicine.
Mm-hmm. Yes, so that is, I don't think many people can say in this era that they're the first person to be in their field. So can you please explain to us what exactly is clinical psychology, so just so that we have an understanding of what it is, and then what made you decide to go down that path, seeing as you were literally breaking new ground when you did it?
Okay, so basically, when we talk of clinical psychology or psychology is really the study of human behavior, understanding why people do what they do, what motivates and influences them to do what they do. So the clinical aspect is really looking at assessment, diagnosis of mental disorder, but not only just mental disorders. So by mental disorder, I'm speaking of conditions or situations like depression, anxiety, substance use, and a wide range of others. And so we assess, we diagnose, and we treat such conditions. Mm-hmm. What led me into it? I actually didn't want to be a psychologist. In fact, I had always wanted to be a lawyer.
Okay.
And then I discovered, so when I went to Chancellor College, I wanted to go in to do law, but they said the law school is not opening yet. But so we'll put you in social sciences, and then when the law school opens, you can move over. So I was looking for 4 subjects to do. I found 3, and there was 1 more. So I asked a friend I met outside the library, and he said, I explained to him my dilemma. He said, well, have you tried psychology? And I said to him, what's that? I've never heard of it. And he said, well, it looks at the human being from birth through to death. And I thought, that sounds interesting. Mm-hmm. So I went and I registered, and the next day I attended a class. And at the end of that class, I knew that was what I wanted to do, and I scrapped the law.
You scrapped the law, okay. That's great, because I think we're blessed for you to have had that realization. Not all the times do we get what we want, what we initially want, but sometimes I think we find out what we need or what we should be doing by, some doors closing. And I think, the law school doors closing, one of the best things that happened for Malawi in that sense. The reason why I wanted you on was because, just to give the background, it's a podcast where we talk to interesting Malawians that are doing interesting things, and we also have the conversations which I think young people are not having enough, right? So I forgot the apple juice today. I usually have apple juice on the desk, but next time. So that being said, I reached out to you because a lot of people have been discussing mental health. Mental health, the term, has become almost like a buzzword of late. We talk about mental health and how important mental health is for people, and that's not something which was... I don't think that topic was talked about when I was growing up. I didn't hear about it. I started hearing about it when I started applying for vacation works, and I'd hear people talk. That was about 2012, 2013. That's when I first started coming across the word. When I worked in South Africa, I heard it a lot. And I thought no one better would be to talk about that topic than you. And also just to kind of lead you into there. It's even more interesting because you started off by saying clinical psychology looks at mental disorders. And from disorders, you talked about depression as well and substance abuse. So those in and of themselves are disorders, according to clinical psychology or psychology in general. So I just wanted you to maybe unpack, first of all, mental health, what it is, and maybe discuss it from the youth aspect, your expertise on that, or your experience on that.
Yeah, sure, certainly. So when we talk of mental health, we're really talking about the capacity that a person has to function, to be able to think, feel, and act in a manner that enables them to fully realize their potential, their ability, consistent with their age, so that they can operate as optimally as possible. But also to be able to be productive and to contribute to the community. So we're looking at a person's ability to, when a challenge comes or a problem comes, that they have the capacity to be able to navigate through it and to handle it. So that's sort of the broadly what mental health is. So when people go through mental health challenges, it's important for us to realize that it means that they are at some level overwhelmed, that their day-to-day ability to function productively is tremendously compromised or greatly affected. So they're not able to really be at the best that they can be. And then we're also mindful of the fact that if we're talking about mental health, we're really talking also about wellness, your mental well-being. It doesn't necessarily mean that you are happy all the time and everything's fine, but that when you go through a dip or through a challenge, you are then able to navigate through it, to handle the day-to-day problems and challenges that you meet, to have motivation, to have goals, but also to be able to trust other people, the quality of the relationships that you have with other people, the quality of the extent to which you are able to set goals, the quality of the extent to which you are able to be able to feel that you are content and happy with life, but even to relax and to enjoy. So really it's looking at quality of life.
Now, there's something which I hear a lot, I've heard a lot, say that the millennial generation is like a soft generation. We don't know how to deal with troubles or trying times. We want everything too quickly, and that's the reason why it seems that our mental health is not good. Like, we're not able to, as from your explanation, it seems we don't deal with setbacks well. We complain that we're not leaving the house. Was it failure to launch? That the term that they call it. Why do you think that our generation, specifically in Malawi, seems to be having such a difficult time with mental health?
Okay, so what we know generally is that currently we have the largest group of 10 to 24-year-olds in history, ever, according to the UNFPA, United Nations Population Agency. So accompanying that are tremendous mental health challenges and issues. Now, we also know that most mental disorders actually begin in the 10 to 24-year-old age group, but they are not discovered until later on in life. So many people go through these challenges. I don't think it is fair to say that the current millennials are softer or don't know how to. I think mental health challenges have always been there. I think it's only now that we're appreciating and realizing it more. And because we are doing that, I think then the current generation also is not isolated. I mean, we are part of a global context, and there's a whole global move. And so there are social pressures as well. So I think we are more aware of that. I think one of the things that we probably might not have or struggle with is I would say might be identity or cultural issues in terms of who are we. And I think that causes a lot of stress. Some people will tend to compare themselves with other people. We know that from social media. There's a lot of depression that can come by looking at how others are behaving.
And some people aren't even
So,
portraying their real self on social media.
they're not. And some people are saying, gosh, that's not me, or I wish I was like that. Therefore, my value as a person is very much based on the material things, or where I'm flying off to, or what is happening around me. So in that sense, there's quite a lot of internal struggle. I was having a chat with some youth like a couple of weeks ago, and I was just trying to find out, about depression and what do you do, how do you understand it? And they're saying that most people feel the depression, which is that relenting pain and sadness that we say most of the time.
Is that the actual definition? It's unrelenting pain or sadness. Is that what?
That's one of the characteristics. So its definition is it's really a mood disorder. It means it's a disorder that affects the way we feel, whether we are happy or sad, and it's mainly sadness. And so some of the key characteristics would be that relenting pain and sadness. Also loss of interest in your day-to-day activities, or the things that you used to enjoy, the things that gave you pleasure. So you lose interest in those. But also the thinking process. For things like you are constantly having negative thoughts, you are feeling you are a failure, you've let your family down, nothing seems to be working, all those negative thoughts. We also know it affects our cognitive functioning in terms of the way we concentrate, our memory, we are more forgetful. And as well as our appetite, our sleeping patterns are disturbed, our energy levels are compromised. But also, we do know that many people, about 800,000 actually, people a year commit suicide. Worldwide. And so suicidal thoughts, suicidal ideation might be part of, is also a part of depression.
Yeah, so you said you were talking with some youth on depression, how they cope with it?
Yeah, and they were saying that they feel that this is normal, that there's nothing more they can do.
It's normal just to be depressed.
Just to be depressed. That's how life is. They don't know that there's another way, that there's an alternative, that you don't have to always feel this sadness, this deep relenting pain within you. But they feel that, well, that's the way it is, and most people are resigned to it. And it's what we call, in psychology, learned helplessness, where people learn to be helpless and to just say, well, that's the way it is. What else do I do?
And what are the tools? I mean, without you're going too far, I'm sure this is something that will take forever to explain. What are the tools that can help us get out of this learned helplessness? Because you're presenting it as if there is another way to deal with it. There is a better way to live. So what are the type of tools we would need to be aware of to get away from that learned helplessness?
Well, I think one of the most important ones is the way you look at yourself, is your thinking. That most people, if you think about it, most of our self-talk or our own thoughts are questions. So when you wake up in the morning, you're asking, oh, should I wear this? Should I wear this? Should I, and as you're going through the day, you're constantly asking yourself questions. And the self-talk, the self-dialogue that we have, often you find that a lot of the questions are actually very self-defeating. Why am I a failure? Why don't things go well for me? Why did I mess that up? Is there any hope for me? And for some people, they carry on the scripts from their own parents. Who talk about, you're hopeless, you're rubbish, you want, and so they internalize that and continue that critical self-talk. And we do know that having that kind of self-talk, but also the way you look at yourself, the way you think about the future, the way you look at the world, if you look at it in a negative way, it does lead to depression. So an important tool, therefore, is to change the way you think, to begin to ask more constructive questions. For a starter, question your thinking. We often don't question. I think that because I am thinking this, therefore it's true. No. If I'm thinking I'm an absolute hopeless failure, it doesn't necessarily mean I am an absolutely hopeless failure. It's a pattern of thinking that I've been that I have learned over time. So the best thing to do is to begin to ask different questions. Questions like, what are my strengths? What am I grateful for in my life?
Mm-hmm.
And then I'm looking at this situation, if things are not going well, but what else is working around, you know?
Mm-hmm.
And a useful practical exercise that has actually been scientifically tested and seen to be effective is that every day or every evening before one goes to bed, they should think of 3 things that went well that day
Mm-hmm.
and why
Mm-hmm.
it went well. And when you do that for 7 consecutive nights, it's scientifically found to greatly reduce depression and anxiety, because your focus, instead of focusing on what is not going so well,
Mm-hmm.
you are able to see the bigger picture and also look at a more balanced picture that this is going well.
Mm-hmm.
This is what is working.
So instead of just seeing all the negative, you start to pepper in the positive in it, and that at the end of the day makes the picture more brighter.
Yes, and more balanced.
And more balanced.
Yes,
Okay.
because the other extreme is to then say, no, it's positive, oh, it's all fine, all
Yeah.
good, you know,
Yeah.
when actually,
No.
no.
Yeah, we do have to take stock of the negative as well, as you said, more constructive questions.
Yes.
So not just okay. So I want to know now, how has the field of psychology grown since you were the first clinical psychologist or psychologist?
It's growing,
Mhm.
yes, it's growing, but in terms of like registration with the Medical Council of Malawi, we have very few,
Mm-hmm.
I think 3 or 4. We are planning to introduce a training where we can actually train professional clinical psychologists who can then register and practice. The need is so huge.
Yes, I think we can discuss kind of the steps towards the end of how to become, because you said the need is huge, and I think the need is huge because I'll give my initial understanding. So it's a very honest moment here. We have spoken before in the context of I was going through a tough time, and my parents said, talk to Chiwoza. And initially when they said that, I was like, what do you mean? Am I that broken? You know, am I walking around in tatters and pieces? You know, and we only managed to have very few sessions, but they really helped me in terms of I was able to let out a lot of things which I think I had not externally said for a long time in a safe space. And it really, as you said, even maybe those were some of the tactics, it was my thinking changed, and I was able to approach life much better after that a little while ago. Now, that being said, a lot of people, when you talk about, oh, you should see a psychologist, you know, if you're having a tough time, people view that as maybe a weakness or a bad thing. It's like people say, oh, no, but I'm strong enough to do this by myself. Is that perception still there, do you think? And what are your thoughts on that perception itself?
Yeah, it's still there. Going to say, quote, a shrink,
Yeah.
those kinds of terms.
Mm-hmm.
And that perpetuates stigma, because we do know that many young people won't go
Mm-hmm.
because they're afraid of the stigma associated. So it's still there, but it's a misunderstanding. It's thinking that because I have a problem, there is somebody to come and sort me out.
Mm-hmm.
But it's really an accompaniment. It's walking alongside somebody, accompanying you on your journey, and giving you, as you use the word, a safe space to just navigate around what it is that one is going through. And going through challenges in one's life doesn't mean that there is a problem. In fact, if we come back to the definition I used earlier of what mental health is, it's about being optimal.
Mm-hmm.
Now, if I'm not optimal because I've met a challenge, and by optimal I mean realizing my full potential,
Mm-hmm.
if something has happened and I'm not contributing meaningfully, I'm not working as productively, that, by its very definition, is a mental health issue
Mm-hmm.
that requires, or that may require to sit down with someone. So if people can understand that we all have or need help or boost or support as we go through various challenges in our lives, and that's normal. So if for example my car breaks down, I need a mechanic just to help because they know just how to sort that out. Yeah. If I'm physically ill, going to see a doctor isn't considered an issue or something to be embarrassed about. But there's just this stigmatized misperception that mental health issues are special disorders, which they're not. Mental disorders are not special. They are, mental illness is like any other illness.
I was going to use the analogy of, we don't, unfortunately, because of the times we are in, it's a very bad analogy. But let's rewind to maybe 8 months ago. If you caught a cold 8 months ago, you just had a cold, and no one would look at you for being weak because you caught a cold. It's flu season. Now, obviously, not a good example because COVID, if you cough, people run away from you. I wanted to just unpack something, and you can maybe say whether I'm understanding it correctly. Because I think you gave a very good example. You said, similar to a mechanic in a car, when the car is broken or needs something to be fixed, you take it to the mechanic. However, I want to unpack that because you've said that it's about being optimal. So it's not even that you have to have a problem in order to talk to a psychologist. So I think that example is good because my car, when I drive it after 3,000, 5,000 Ks, I have to go for service.
Correct.
That doesn't mean that my car's not driving well. It doesn't mean that I'm hearing any problems. But the service will keep it running optimally. For the car to run, it needs to be serviced after a certain period of time. So it shows that as a psychologist, what you do, in my view, is that yes, you can fix problems when they are there, but also you just help service and keep people going as well. You don't have to be going through a earth-shattering, depression in order to talk to someone. If you want to be more optimal, it's still a good thing to talk to a psychologist, which then takes us to, I think, one of the closing points I had. There are 4 people registered, right? About.
Yeah.
And country full of 18 million people.
Yeah.
One, why is the rate still so low? I know you say you're increasing, but maybe I should ask it this way: are there enough people applying to be psychologists or trying to be psychologists now? And second to that, what is the path if someone is considering to do that?
Okay, so there are different types of psychology. We have health psychologists, educational psychologists, counseling psychologists, clinical psychologists. So there's a wide range of different psychologists. So the thing about psychology is that, and Malawis particularly, is that we really have very limited professional training. In fact, we hardly have any. Like for clinical psychologists, we don't have any space or place where you can be trained yet. But we need to do that. We need to have that. We need to work towards having a space where we can have clinical psychologists, where we can have a wide range of professional people. So the path normally to become professionally registered is you do your bachelor's degree in psychology, general psychology.
And that can be done in Malawi?
And that can be done in Malawi, yes. And we have several institutions that do that. And then you then specialize. You either go in at master's level, you go into counseling, clinical, educational, health. Yeah, educational is really looking at things like assessing children and seeing school readiness, for example. And then so once you've done your master's, you can qualify and you can register. So we have general psychologists, we have clinical, and we have a register for clinical social workers, and or clinical counselors rather, and one for clinical, we have clinical social workers, counselors, and and psychotherapists is the other one that we've just started registering. Yeah, so that's a sort of rough path, but there are many different wings that one can ride on.
Okay, all right. So I'm hoping anyone who's watching, who's thinking about it, knows that there are paths to get there, because I think we need more, and we need more people to make use of those of you that are here already, and maybe will be better for it. I think as you said, the misunderstanding, the misapprehension is an issue, and what you talked about, this learned helplessness, it's one of the, I'll say this, maybe we can cut this from the recording. I don't know if I'm harping on it too much, just because I know we haven't discussed this. Was the reason I started the podcast was because I had reached a stage where I would go online on my social media, and it was 80% negative stuff, most of the time. And I would see, on the social media spaces, when things are trending. So someone makes a post, it's trending when a lot of people are engaging with it. So I'd go online and I'd see the trending topics, the things that everyone's really harping on about, was always around some really negative, useless stuff. And I said, it started to weigh me down so much. It could be like sometimes I just want to go online and see someone saying something positive, and I realized that maybe there was need for more of these positive and maybe constructive conversations to be there. So you are the change you're looking for. A friend of mine, Tuape, said that. So I guess that's the reason why it started. And I think this is going to be very helpful for people to unpack. Hopefully we'll unlearn this helplessness. I've had a conversation with one of my friend's dads in a similar position to yourself, in terms of he was one of the first in his field. And we were talking about the differences that we are facing in terms of, I said, I've entered into my profession when it's flooded and there's a lot of lawyers. You can throw a stone and you'll probably get sued because you'll probably hit a lawyer. But whilst in his time, he was the only person in his field. And he said, you guys stress too much. I said, no, it's stressful because having a degree is no longer enough. And, you're comparing yourself to these guys, and there's these people who are doing this and all that. And I think social media is a big influence in how we view ourselves. And I think as you said, there's so many things that are happening from age 1 to 24 that we're just carrying. So a lot of our generation have grown up being the first ones on Twitter, the first ones on Facebook. And I think it's now starting to show in us, because we've reached a stage in life where our life has been so comparative since a young age. I had a friend of mine who he beat the record at Community Academy for 100 meters. If he was to do that in this day, someone would be like, yeah, but there's this guy in Canada that ran it even faster than you, and out of nowhere his achievement goes away. So I think it's something we have to learn to traverse, and hopefully we'll equip ourselves with the tools to do that.
Just to say perhaps that I think it's important for us to realize that there is no health without mental health. That as we go through the challenges, as we go through this current COVID, the uncertainty, it's okay to be anxious, to feel that. I think we are very cruel to ourselves. Mm-hmm. We need to be gentler and more compassionate on ourselves. Mm-hmm. We often judge ourselves. We say, I shouldn't feel like this. But I think it's important for us to just pause and to just reflect and see what we're happening. Mm-hmm. To just stop and self-check. Mm-hmm. I think that's a very important mental health exercise. Okay,
and if I can say anything else, to translate what Dr. Chiwoza said earlier on, rate yourself. That's how we would say it. Okay.